Hi, my name is Melissa Brendt, and I'm the Vice President and Chief Contracting Officer at Sutter Health. A little bit about our network. Sutter Health is primarily based in Northern California. We have about 5,000 physicians, including new walk-in clinics, 24 acute care hospitals, about 51,000 employees in the Northern California area. We do things like home health, DME, hospice, and provide outpatient surgery in many centers across Northern California. And we're working on lots of innovative ideas like MD Live and other telemedicine programs. We're really proud at Sutter. We were recently awarded Truven Health System's top 5 healthcare systems. And those awards are primarily based on quality. Some of them include saving patient lives with less complications, spending less dollars on patient care per episode, shortening patient lengths of stay, making fewer safety errors, and we had really high patient satisfaction scores. Again, super proud of that in our organization. Today is the first of what we hope are many series about staying connected to brokers and other healthcare partners and purchasers of healthcare. And today's presentation is about that. We're going to talk a little bit about what's primarily in my world in healthcare, and that's our contract negotiations and how that affects delivery of healthcare. And if you have questions during the presentation, you can certainly ask them. Otherwise, we'll field them at the end of this short presentation. A little bit about why we're speaking today is about affirmations and the reason behind how we got to asking our self-funded payer clients to sign affirmations. There was a recent court ruling in which the health plans were given the responsibility of taking affirmative steps to bind self-funded payers to the health plan contracts in which they sign with providers. So this particular presentation will be focused on how that process impacts your clients that you represent with health plans. Part of the reason that we're entering into this new process is to make sure that self-insured organizations and payers that access our agreements understand all the terms that are relevant to them in our provider contracts. And we're very open to and committed to transparency on those terms. And that's why we're doing the affirmation process, to ensure that your payer clients get copies of those contracts and understand them and recognize how they will impact them. This presentation today is to clear up any confusion or address any questions you have about that process for your clients, and even discuss any alternatives or other questions that you may have regarding our contract terms. And the timeline that we wanted to share with you about affirmations really do vary across the payer health plan contracts that we have, and they're primarily based on your clients and their renewal dates. So it'll be hard for me to be specific, just to let you know that. But it is our goal to work with all the health plans and all of their payer clients, self-funded organizations who access Sutter's network through them. I know I'll get asked this question. We do have a few renewals up again this year, so I thought I would just share that right away. This year we're in negotiations in negotiations with Cigna, Blue Shield, and Health Net. So just so you know. And at the end of the presentation, if you have questions or you need follow-up, Denise Vance, for those of you who are interested in any follow-up questions that we don't handle today. So I'm going to go ahead and get started and see if there's any questions. I'll open it up. So why are employers required to sign confidentiality agreements to receive the contract? So the contracts between health plans and providers are confidential as to those parties. And so to access those agreements, payer clients have to sign sign a confidentiality agreement that says that they will keep those terms confidential to the parties. So it's important that you and your clients make sure that they sign a confidentiality agreement, and then the health plan should be willing to share that with you once you've done that. Sometimes they call those NDAs as well. This one says, my self-funded client received a redacted copy of the contract and is wondering why the rates were blocked out. So we at Sutter didn't do the redacting on the contracts. We're leaving it up to the health plans to decide what is a relevant term in the contract and then sharing it with you. We do not consider the rates in the contract to be something that should not be shared. So you'll have to talk to the health plan directly if they redacted those rates and you're interested in getting them. Why have we not seen other providers or provider systems asking for the same thing? I don't know yet how fast the industry will react to that court decision, and I'm not sure. I suspect that you will see other provider systems looking for affirmations or some assurity that the payer clients underneath the health plans understand those contracts and the terms that they're responsible for and that go with accessing the network and the discounts of providers. I just can't speak to the timeline in which you would see that from other provider systems. Why affirmations now? Well, for us, again, it's was partly based on the court decision. And I think what we've been learning is that payer organizations or self-funded clients haven't really understood or had access to the terms in which they were bound as being associated with health plan agreements. And now it's really important to us to avoid any disputes or active disputes or new disputes and make sure that your clients have access to those terms and understand what they've been bound to and what they've agreed to access the network. So we hope that this is actually a good step towards transparency. This is an affirmation of what we always thought all parties knew. And I think that that's something that was probably not well understood by the provider industry. I think we all knew when you showed up or believed when you showed up with your identification card at a physician's office or a hospital, when the card said that you had Anthem or Blue Shield or Cigna, that the payer client underneath that contract knew that those were the terms that they would be accessing in our agreements. And I think we're just now learning that there were some self-funded payers that didn't understand that necessarily. And I think that it's really important now that we all are very clear about that. We don't want any misunderstandings. Your clients do need to understand what's in the contracts and what they've agreed to access those discounts in our network. It's very integral to our entire relationship with a payer or a health plan. If the plan sponsor can't see the rates, they're redacted per ERISA, how can the fiduciary sign off? Who's ever responsible for paying the claim should be the party that understands the terms, would be Sutter's position. And I would think that everyone else would agree to that. We first and foremost want to make sure the party responsible for paying the claims understands the terms of the agreement. So in fully insured business, the health plan is agreeing to those terms because it's underwritten by the health plan. And so in the case of self-funded business, it's our assumption that the self-funded employer is responsible and would have to pay the claim. So that's really the party that has to understand the terms. So whoever's going to own the financial relationship. Next question. Aren't the information that's available in the EOB that both the members and the providers receive, aren't those the rates? I suspect that in some cases that would be true, but I don't know that everybody sees all of those all of the time. Those go to patients and they're not something that the actual self-funded client has access to every service. But again, we're just making those rates available through our agreement with the payer that you can certainly see them. There's a lot of details in those contracts. I suspect that some folks would need help interpreting them. Healthcare claims can be complicated when you're having a big surgery and lots of services available. But I do agree that for individual services, members EOB does share what those contracted allowables are. What's the timing for returning the affirmation form? That's a good question. I've been asked that before. Really, that's between your client and the health plan and their timing of their renewal and any administrative timing that they've asked to have to get those processed. I've heard other varying dates for clients to get their affirmations turned in to the health plan, and we would send you back to them. We didn't dictate or don't have any process requirements. Those are really administrative rules that the health plans have come up with based on their needs or their business goals. This question is, if the health plan refuses to provide the self-insured plan with the fee schedule, will you provide the self-funded plan with the fee schedule or offer to honor the fee schedule provided to the health plan if the health plan sponsor directly contracts with Sutter? That's a two-part question. Again, it's Sutter's position that our contracts say that any self-funded client may have access to any relevant term in the provider contract. We believe that rates are relevant. So I, again, would send you back to the health plan to get copies of that directly. And while it isn't our habit to directly contract with self-funded clients, we're not opposed to that, and we would entertain that type of conversation. We've had a few of those agreements over the years, and we're not opposed to doing that. If you have a payer client that's interested in a direct contract and they'd like to talk to us about that, then I would suggest that you contact Denise and see if your client, if that makes sense. But again, I would also suggest that you talk to your health plan about any of the implications associated with direct contracting. I don't know if that changes their relationship for claims processing or administering benefits, etc. Something that we wouldn't be privileged to. Are signed affirmations being collected by Sutter? No, signed affirmations are not being collected by Sutter. We just would like the health plans to do all the processing of this. It's their responsibility to make sure that clients have the transparency and the rates, or whatever is applicable to them. And we would like them to keep that on file. We have the right to ask for a copy. If we get it, we're not having those returned to us. They'll go back to the health plan directly. Is Sutter Health going to ask of the health plan and network PPOs of the others obtain affirmations? We actually have other network PPOs that already have this responsibility, and we are going to ask all the others to do the same. And we've already encouraged them, all the payers and all the network PPOs, to please be transparent with the contract terms. We always believed that self-funded clients had access to relevant information in the existing agreements. And in our current contracts, there is a process in which you could get those terms. Now we're just asking affirmatively that they do that. And we're going to do that again in all of our upcoming renewals as well. Are you doing this to discourage the reference-based pricing arrangement? I'm not sure I understand the question. We're not doing this for any other reason than to be transparent about all the contract terms in which your clients required to be bound to if they're going to access our discounts. I don't know how that would discourage reference-based pricing. My interpretation of reference-based pricing would be that you would probably want to know the rates and the terms in the agreements even more so. So I would think it would be supportive of reference-based pricing from my understanding. So I have a question here about arbitration and actually why providers' contracts have arbitration clauses in them with health plans. And I will tell you that for Sutter, and I think this is not unusual, we've had arbitration provisions in our contracts with payers for as long as I can remember. I've been doing what I do for about 20 years at Sutter, and before that, I worked for health plans. I think arbitration provisions are common in business. I think they're common in even member their health plans and their evidence of coverage if they have a dispute regarding a service or benefit. So we think that those are common practices. We also think that they make things more affordable. We're working very hard at Sutter. I think our entire industry is working hard to keep healthcare costs lower. And we all know and understand that litigation expense is more costly in non-arbitration settings, and that cost of litigation will end up in administrative expense for all parties, and that up in what your clients and even fully insured clients ultimately pay for healthcare. So really it is our goal to be more affordable, and we believe that arbitration process is standard in our industry and something that the court systems have always preferred. I hope that helps answer that one. This question is, can you please help review what an affirmation document is? So affirmation document to us is or certification from your clients that they've been able to see the contract and they have had full disclosure of all the terms and they understand them, or they've had an opportunity to review them or speak to a consultant about them, and that they understand that they're bound to those terms. This is something, again, that in the provider world we've always believed was true. Again, if you showed up with a card that said you had Anthem Blue Cross or Cigna, we called and dealt with that plan organization based on those contract terms. It's where we call to get authorization. It's how we determine where we're going to get our claims sent to, how we're going to get paid. And so we just want to make sure everybody understands that. So the affirmation form is really about documenting that the health plan has done what they were supposed to do, and that they've educated their payer clients that are self-funded about those terms that they negotiated for them, and that they understand what they'll be bound to in the contract. Is Sutter also willing to provide a copy of the charge master so that members can compare fees? You know, charge masters, maybe some folks don't know this, are publicly available, and they have been publicly available through OSHPD for years by law. And we have all of our charge masters, or I think there's a law about having the top 500 codes at least available at all the hospitals. So you can see the charge masters. And again, they've been mandated by law. And then on Sutter Health's website, maybe some of you don't know, we've taken affirmative steps to actually put our charge masters, the top, I think it's about 225 codes for our professional providers are available on Sutter Health's website. They're not contracted rates, they're charges by typical CPT codes or services that we provide. We're not obligated to do that for professional providers, for doctors, but we do that anyway. And if you go to sutterhealth.org, you'd be able to see those top 25 charge master codes for all of our physician groups. And we have updated that biannual basis if those change. So that was a good question. Does the TPA have to sign attestations? Actually, the TPA does not, or an affirmation does not have to sign it. It's our preference that the actual client that's responsible for paying the claim would sign that affirmation agreement or certification. How will this impact carrier negotiations for renewing networks? I'm not sure. That's a good question. I hope that we'll get lots of support from the rest of the carriers on the affirmation process. We think it's a good thing. It is about being transparent, and it is something that the court system required them to do. In this appellate court decision that we got, what it said was it's the health plan's responsibility to make sure that their agreements were consistent between the provider and the self-insured organization that was accessing the agreement. So hopefully this will help this process along. And again, we believe it's the right thing to do for you and your clients as well. We want to avoid disputes, not have more. So I'm hoping that we'll continue to have support in this process. What other steps is Sutter taking? It's kind of a generic question, but if it's related to transparency, the steps that we're taking, some of them I've already shared with you. Again, we have a website which publicly displays lots of our charges. They're not contracted discounts, but they're charges. And we're working very hard to answer questions that carriers or brokers have. I've been out meeting with some of the brokerage houses and consulting firms directly, and I'll continue to do that as well to answer any questions we have. We've had some conversations with employers, self-funded employers directly along with their carrier and their broker, and that's something we're willing to do. If we think that makes sense for your client, you should let us know. I think you can reach Denise again to have that conversation.